Three. Okay. Here we are. Hello, everyone. We
Hi.
have we have our mentor Tikwa, and she will tell us about some important hints about case taking and observation, and about what the question should be asked during taking the case. Okay.
Okay. Well, hello, everybody. There's an important concept. Some people think that nobody should ask questions of the patient while we are case taking. Now, Hahnemann tells us that we have to not only ask questions, but we have to ask them in great detail. And we have not only the Organon to go by for this, but we also have this nice book by Bonninghausen. Does this turn
Yeah.
up backwards for everybody? Okay, I'm going to read a little thing here. He's talking about the physician's record book. Bonninghausen says, since the Organon of our Hahnemann is out of print, what? They're trying to train homeopaths back in this day and age without a copy of the Organon. How crazy is that? Mega crazy. So therefore, you see a lot of early homeopaths are not getting proper instruction as needed to do what they need to do and do their job properly. And a lot of allopaths were disenchanted and unhappy with the system as it was, and they were turning to homeopathy, but they were confused, and they were especially confused because there were no copies of Organon in print. I continue with the book. Since the Organon of our Hahnemann is out of print, and in consequence, many of our younger homeopaths, without their fault, are unable to read and take to heart the leading principles laid down there, and which have especially to be considered here, it will not be superfluous to quote in the paragraphs of this masterly work verbatim what is needed for this discussion. So in this book, Bonninghausen is going to give us a whole bunch of aphorisms about case taking so that we know what to do. Now, one of the things that some people are confused about is whether or not to ask questions. But the depth of the questioning obviously depends on whether it's an acute case or whether or not it's a chronic case, and whether or not it's a long-standing chronic case or whether or not it's a brand new chronic case, the age of the person, et cetera, et cetera, et cetera, et cetera. And as everybody says, the way we go about case taking is individual, but there are certain guidelines to follow. So Hahnemann recommends that we keep a booklet and we write down what the person tells us, but then leave space underneath it to fill in information like modalities. So let's say the person says they have a really bad headache. Now, as a homeopath, really bad headache, where do we go from there? Yeah, that could be how many remedies for really bad headache? Anybody? You? Nobody? Okay.
There are
So
a
anyway,
lot.
yeah, there's a lot of remedies for really bad headache. So we need to go and we need to get an exact description of the headache problem. Let's say that the headache is an acute. We look at it differently than if it's a chronic reoccurring headache. But anyway, we need to say, what does the headache feel like? what does the when is the headache? Do you notice that what types of things happen before you get the headache? There's just like a multitude of different things for modalities and sensations and mood that associates before, during, or after the headache that will all influence our prescription. So that's number one. So we have the person who's going to tell us their problem. And then we're going to, when they're finished talking, first we just let them talk. And unless they get sidetracked and start talking about what times the trains are, something that has absolutely nothing to do with anything, which we might want to think about in the back of our head, why is this person sidetracked? But, we want to keep, business to business a little bit if we can. You just kind of have to gauge these things yourself, So we write things down, then we fill it out after they're done talking with the different things that are going to give us the important information. And if nothing particular has been mentioned about any system of the body, about the mood, the disposition, about the stomach, about the urinary tract, about how well they walk or their mobility. We could just go on and on, depending on the need of the case and depending on what the situation is. Like for an acute, it's going to be much different than for a chronic. For a chronic, we need to know not just what they tell us, because they might not know what's important to the homeopath, because we're looking for characteristic symptoms, we're looking for unusual symptoms, we're looking for unusual patterns, and we need to know even things that they don't spontaneously tell us. So we can just say an open-ended question like, tell me about thirst. Tell me about urinating. Tell me about your bowel movements. Tell me about that head pain. And just keep it really broad and then keep saying things. Yes, go ahead.
Yeah. Actually, I was trying to say, whenever the patient is coming to us, and probably he will be telling those symptoms which are actually bothering him. He is actually concerned for those symptoms, right? So probably he is telling those symptoms, and we have to take those symptoms as they are, and then we can confirm with the modalities and type of related symptoms, right?
Right, very important. Yes, of course, we
Yeah.
take that as the primary thing, that's what they're here for. But then Hahnemann says something interesting about that. He says that the patient will come and they will want to have certain symptoms relieved first. And this is a mistake, because this is not up to them. We don't know what the vital force is going to do. So we need to take a complete case, and then we will give the appropriate medicines, and whichever symptoms are relieved first are going to be the symptoms that are relieved first. And that's an interesting point. He says we can excuse their ignorance, because it's not truly our job to just, take care of somebody's long-standing medical condition, and remove the symptoms they want. It's just the healing's going to happen in the time frame that it needs to, according to the vital force. That's a totally different thing if somebody comes in with a bad cold. You're going to just zap that out, no problem. But, you got somebody with heart disease, you've got somebody with arthritis. We don't know which things are going to get better faster. than the other things. But one thing that's very important is that we will see a change in the mood and the disposition, and a person will start to feel better when they're on the correct treatment and going towards health. Sanjay? Oh, that reminds me. We were talking about periods. A lot of women, unless they think they have a problem with their period, won't know they have a problem with their period. So this is something that Hahnemann specifically mentions that we need to inquire with women. We have an aphorism. Sanjay, do you have that aphorism handy with the footnote about the menstruation, the color of the blood, the childbirths, the miscarriages, the nursing babies, and all that for the female symptoms that needs to be examined in a chronic case? Did you pull that up for me? Okay, well, anyway, there's a footnote that Hahnemann says that in female cases, we must examine the childbirth, the miscarriages, the color of the menstrual blood, the timing between the periods, the duration of the bleeding, etc., in detail in order to come to the right prescription. And this is something that we need to inquire with all chronic cases, because a woman might not know that her period every 24 days for 8 days, with just a little spotting here and there only at night, is abnormal. You don't have any microphone. Can you turn on your microphone, Sandra, so that we can talk a little bit?
Okay. Shall I share the screen so you can read those aphorisms?
I didn't really want to read aphorisms. I more wanted to talk about things.
Okay.
Okay, so I think we've got it that we need to inquire about female reproductive health, because people don't always know there's a problem, and these can have very key symptoms.
Yeah.
So anytime somebody comes to us with a problem, we take down what they say, and then we fill in what we need to by asking really open, broad questions that will not give a yes or no answer and will not just be given to us to satisfy their need. You know, that some people feel like they don't want to take too much of our time, or somebody, might feel like, they just want to be a pleasant and easy to get along with patient. So we just want to do more for them than what they're just putting out there for us. It's not unusual for, let's say, a Canadian or a European homeopath to spend 2 hours for the first appointment. Not unusual at all. Because we want to know about their whole life, basic things, things about their lives, things that have changed, significant lifetime events. These things can all factor into our prescription. So it is a somewhat laborious thing to go through a lot of different details, but thankfully, a lot of people really like to talk about themselves. And I'm more than happy to say, oh yes, and then I got scarlet fever when I was 12, blah, blah, blah. there's just, people like to talk for the most part, at least, in our society. I know things what I've been in India, it's been a little bit different. People come in with a huge pack of friends and family. How are you supposed to get all these really important pieces of information, for a chronic case with a whole pack of people in the room with them? You're going to be talking about some pretty private stuff. And that's not the way we work. We see children with their parents, but not adults. We see them on their own so that we can have that good heart-to-heart talk. And then one of the things, as I'm kind of like selecting rubrics that I really like to do, is I'll say, just talk. Talk to me about anything that comes to mind. And sometimes I get really brilliant information from that person just saying whatever comes to mind while I'm selecting rubrics on my computer. Get some brilliant stuff there. It's kind of like a free association.
Yeah. Let others people ask something. Girish, unmute.
Yes, sir.
Turn on your camera and you can ask questions if you have any. If you have any.
Uh, no questions, sir. Right now, just listening the talk.
There's a really wonderful thing then we can bring up here again by Boardinghausen. I'm telling you again, guys, get this book. This book's really good. He gives us brief directions for forming a complete image of a disease for the sake of homeopathic treatment. And this is page after page after page of things for people to fill out. And it used to be back in the 1800s that people would contact the homeopath by mail. Okay, guys? Or by, by runner. They'd send somebody on horseback, or they'd send it through the mail. And so this was formulated for people to fill out so that nothing was missed. And for the homeopath, even if we've been practicing for a long time, to review matters such as this is so helpful because, we get an idea of the different things. It has, it starts with vertigo, then impairment of the understanding, loss of memory, internal headache, outer head. This is all how, all with its modalities. So when we're really investigating a case, unless we can turn to all these things to get more information. And this is not just for beginners, even though sometimes we will get the information we need quickly and easily. This can be very, very helpful. Like he's got sight and vision. Whether or not he gives like a list of things with modalities, time of the day, position and circumstances, aggravated and improved, right? We know all this, but sometimes when we're in the clinic, we might not think to ask it, or maybe we'll feel rushed. We really have to make sure we have sufficient time to take care of people properly. Okay, we have somebody else here. Do they have a question?
China?
No, sir, I don't have any question. I'm carrying on with the hearing. I'm just hearing it. No
Okay.
questions. Understood the point.
Okay, thank you.
Okay. So you want to sum
Say
things
one-
up for us? Oh, go ahead.
Go ahead,
say
ma'am.
one.
But sometimes I want to say one thing, ma'am. Sometimes
Yes.
a patient become accustomed to some things like they feel that it's a part of their routine, so they don't come up with the question. Then we have to probe them, na?
Yeah,
Right.
exactly. You have to probe them with very careful probing, with very open-ended questions, so that they'll just talk about it. Yeah, we definitely, people, you're absolutely right. When people have had a chronic disease for 10, 15, 20, 30, 40 years, they're not going to remember, you know, what's really a problem and what's not a problem, unless it's like an acute thingy that's really hurting them, or if they have a diagnosis or something like that. But a diagnosis just gives us general information. It doesn't give us specific information for prescription. But yes, it requires careful questioning.
Okay.
Carry on further, ma'am, now. Thank you.
Mhm.
Okay.
Oh, we got somebody else logging on.
Praveen.
Mhm.
So here it is very important to know whenever patient is familiar with the complaints or he is habitual with the complaints, probably like Shine has told, they might not reveal or tell those symptoms. So as you have said that we should ask him to just talk about himself, his routine, his life, his lifestyle. That's what we learned from aphorism 5. So for the
Mhm.
chronic diseases, uh, what we can see in the disease. When patient is talking about his lifestyle, he might say he is having a difficulty or taking time to evacuate his bowels, or he has means habitual to a slight tenesmus during defecation, like that, or he is having bloating in the abdomen or hyperacidity, like that. Many there are common symptoms that might be a familiar or habitual to the patient. So when
Yeah.
he's then when he talk about those, he might tell us about his habits, about like drinking or tea or coffee, or say his eating habits, his diet, what he is actually eating, whether that thing is okay.
Which brings up something very interesting, a phrase that I really like from Margaret Tyler. She says that when people like a certain food or dislike a certain food, it doesn't matter to us very much. But we want to look at
Right.
something called longings and loathings.
Exactly.
Longings are something that is craved, that people really, really want to eat. They just love it. They gotta have it. They need it, and it's a longing. They need it. They long for it. You know the word? What's the word in Hindi?
About which word?
Longings. When somebody really loves something, they really want it. They want to eat
Desires.
it. Okay. And
Desire.
then
You
there's
can say desire.
desire. But what would you call it in Hindi?
Hindi.
कुछ चीज चाहना,
Chahat.
ख्वाहिश होना,
Chahat.
चाहत.
Khwahish.
Yes.
Chahat.
Okay.
इच्छा
Uh,
इच्छा
Icha.
okay. And then loathings. Loathings are the things that the person finds disgusting. They cannot eat it. It is gross. They can't do it. No way. Don't put that in front of me. Can't eat that. Okay, so longings and loathings are important. Whether or not somebody kind of likes spicy food more than they like sweet food, this is all just a little bit vague. But the longings and loathings, those are important, unless it's an acute. In an acute, this can be a key factor. But for a chronic, that, you know, but if something causes a symptom, for example, if somebody can't eat white flour because it gives them terrible indigestion, that's something we need to take notice of. But that's neither a longing nor a loathing, because they might like things made out of processed wheat, but it's something that causes them pain. So all these little details are so important. Take a lot of time with your patients. Take time to write things down, then go back with the modalities if they haven't been told. When is it better? When is it worse? How does it feel? How does it feel when it, you know, what time of day? Like I had, it wasn't very long ago that somebody had a pain in their leg. And I said, what do you do to make it feel better? And so she took her phone camera, because we were doing a video because she was sick. And she showed me how she rocks her leg back and forth, and that motion makes it better. So these details are very helpful. So as much detail as you can get from people, the better off you will be, and the easier your work will be, at least, you know, as time goes on. Not that the work is particularly easy, because it isn't always easy, but that's the way it is. Do we have any questions?
One minute. I think he is having problem. Faisal.
Yeah, Faisal's having a problem. But when he watches the whole thing, he'll see how we talked about people's
Ah.
periods and their childbirths and their
Yes.
miscarriages
Yeah.
and their breastfeeding, and whether or not their bleeding is for 4 days or for 5 days, or if it's only in the night or only in the day, and all that for females, because that's what we were talking about yesterday, which spurred this little, oh, we have a message from Faisal. He is not receiving voice.
Nothing from here. It's from at his side.
Okay. Did you get that, Faisal?
Faisal, check your audio setting on the left lower corner. Praveen.
Yeah, so this is what that discussion that we had in the group yesterday is what inspired us to come on today and to record this so that people could watch it at a later time, and hopefully it'll help people. I hope that these kinds of little video sessions will be helpful, and I very, very much want your feedback to know if it is helpful, and don't just be nice. You know, I want real feedback. Is it helpful?
Praveen, do you have questions?
Sir, I joined too much late.
No, it is just common. What is important in case taking? Whether we have to just observe or we have to ask questions.
Okay.
Yeah,
I have
observation
a
is a totally separate topic that we can get to another time.
7
Okay,
pointers
ma'am.
to bone emotions play important role, no? In case taking 7 point to find out remedies.
I didn't hear the whole question.
Can you repeat?
Sanjay?
Boning
There
Hussain
is
talk about 7 points to find out remedy.
hexameter. He's talking about
Examiner,
Boning
examiner.
Hussain hexameter. Boning Hussein's
Oh,
hexameter.
hexameter.
Yeah.
Yeah. Yes. Yeah, that's helpful. I
That's
recommend to people to print that out and keep it next to their computer, just in case they get stuck.
yes.
Yeah, or just even a simple list of locations, sensations, modalities, concomitants, and changes in the mind and disposition. So when people say that, they have, since they've been sick, they're just like so sleepy that they can barely talk to anybody, then we consider the rubric dullness, as opposed to, since I've been sick, I just can't rest and I'm just thrashing around in my bed, then we want restlessness. Right, guys?
Okay. Yes. Yes.
And one more thing we have noticed, a lot of people actually considering the mind symptoms, a normal behavioral symptom of the patient as the rubric for selecting the remedy.
Oh,
How
this is a
correct?
very, very important topic. You go on with this, okay? You talk about this. This is very, very important.
What actually Hahnemann told in aphorism 6 is only that the homeopath should consider only those symptoms which are change on the physical level, mental level, and emotional level. Nothing beside change symptoms we should consider. If the patient or his relatives is telling you that the person was not like this earlier, but now he is different from the sickness or during sickness, only those symptoms are actually important. We cannot take a normal behavioral symptoms of the patient. Many patients might say that his behavior might be due to his lifestyle or his stress factor and like that. That can be considered if you are treating a chronic condition and not the acute one. And remember, the patient has come to us at present for the acute complaints. Those complaints might be the acute exacerbation of chronic disease. We have to
Which is
consider,
frequently the case.
yeah, which is frequently indicates. That's how the Hahnemann has classified acute diseases into three categories. One is individual, other is sporadic and epidemic. Okay. So other than sporadic, we have individual type. In individual type, we see only those diseases are restricted to the particular individual. These are acute exacerbation of chronic diseases of that particular individual. And patient is usually coming to the physician to treat these acute diseases. Right?
Yeah, if let's say you're, okay, since coronavirus is a big thing now, if somebody comes to you with corona, we don't need to examine their whole life. We need to look at
Exactly.
right now, their symptoms today, their symptoms since they got sick. Okay. And then what we need to do in order to keep them from developing other problems after their corona is better. Oh, and we want to treat corona as soon as possible because it prevents complications. We don't want to have somebody's oxygen level going really, really low when we can get to them faster. But anyway, then we want to follow up with an antisporic with all acute diseases of this type. if somebody comes in with dengue or typhoid, afterwards we follow up. If they haven't come to us first and said, I'm having such and such symptoms, and you see clearly they need silica or sulfur or something like that, then you do need to follow up and give a really deep acting remedy to finish that cure. And in that way, we prevent sequelae and things like, how everybody's talking about long COVID. Well, you can prevent that long COVID by giving a deep acting remedy at the end of treatment, which will sometimes be very, very well indicated. And sometimes you'll just have to give a dose of caliper sulfur, depending on the situation. And we are running out of time. And we really appreciate you guys all coming today. And this will be recorded, and Sanjay is going to upload it to the Homeopathy for Humanity YouTube channel so that you can watch it at your leisure and see what you missed. And thank you so much for coming and joining us today. And I hope that people, you guys or everybody else who watches it, get something out of this. And please leave feedback about what kinds of things that you find helpful or less helpful, or what can be changed to help service your needs better.
So, friends, any questions? We are just running out the time. We have only 5 to 6 minutes. If you have any, you can review to help us to help you. China? Hello?
No questions, sir. Understood. And thank you very much, ma'am and sir.
Yeah, so share the video. Oh, guys, if you want to share these videos or any of the other videos on the YouTube channel, please do so. Don't mind. Okay, should we sign off?
Probably Faisal might have a lot of questions, but unfortunately he is not having sound. Oh, Faisal?
Hello. Yes,
You
now
Oh,
I'm
there he
listening.
is.
you have 5 minutes. You have 5 minutes if
Okay,
you.
thank you. There was mistake in my setting. I have changed that setting. Now I'm listening.
Faisal,
Okay,
we
well,
actually
go ahead.
talking about uh, case taking part. What the
Okay.
patient, what the homeopath or a physician should ask, and what he has to observe, and on what factors the main intention should be laid on to treat the case. That's what we have talked about. Yesterday we have discussion in the group on that. If you have any question or if you have anything to say, you have 5 minutes, 4 minutes now.
Okay. Thank you very much for this session. I'm very late, and thank you very much, ma'am, for joining this session and giving us an opportunity for learning. I want to ask one thing. When a patient does not want to tell something, then what a homeopathic should to do? If a patient does not want to tell something, for example, a female does not want to tell you about her menstrual, it is our some society problem that if a female patient comes to us for her teeth problem, chronic teeth decay, and we ask her for menstrual cycle, and she does not tell. So what we should to do in that case? I face this problem today. So this is my question today.
Well, that's a complicated question because of the cultural situation. Where we live, that's not really an issue. So I'm not really, that kind of thing isn't a big deal here. because you're obviously meeting with your doctor. So maybe somebody else can comment on how to get around that.
Actually, what I would like to say on this part, homeopath should not hesitate to ask such questions. He should boldly and freely should ask those questions. If you ask them freely, then probably patient might tell you. Remember, patient will only concern for those symptoms which are bothering them. So if the menses is bothering the lady, she will definitely tell you.
But she might be shy, like he was saying. She
Yeah,
might
yeah,
feel
yeah.
reticent, you
But
know.
if
But
if she has came to a physician only for that complaint,
then she'll
then
probably choose a female doctor.
yeah,
Like if I go to a gynecologist, I'm not going to go to a man gynecologist. You think I'm crazy, right? No,
Right.
I'm not crazy. I go see a woman.
Okay.
But yeah, I mean, you just try to gently say, you know, is it too long? Just simple things, you know,
you
that
can just
try to make it
casually,
comfortable. Yeah,
yeah,
casual. Just, you know, make it seem like you're friendly, but not too friendly, and just casually try, you know, do your best. If she has a significant female problem, maybe send her to a female doctor and then confer with that female doctor.
All right. Thank you very much.
okay, guys. Here we are in the last minute of the session, and we will conclude now. And probably we will upload this video, and you can listen this again and share on your page.
If you
Right.
want to, if you find it helpful. And please give us feedback about what's helpful and not helpful, because every time somebody gives me an idea, that helps provide more content.
Right.
The more questions, the more content that can be provided. Thank you so much for joining us. Really appreciate it. And thank you for the spur of the moment activity here. Everybody take care.
Thank you.
Thank you very